Eastern Cape 1,504, Free State 135, Gauteng 2,014, KwaZulu-Natal 1,394, Limpopo 54, Mpumalanga 63, Northwest 51, Northern Cape 30, Western Cape 6,105, makes a total of 11,350. As of to date, a total of 369,697 tests have been conducted, and the 13,630 tests were done in the past 24 hours. Largely from the public sector, 63% of the tests were done in the public sector, which is about 8,599, and only 5,031 were done in the private sector. Thank you very much. Then, just as a matter of update, we keep track of all the health workers who have tested positive. At this point, our total is 580. Doctors, nurses, and other different categories, both in public and private sector, that have been affected or tested positive of the COVID-19. Thank you very much.
As a country, we set ourselves a target that maybe if we reach this stage, we will be able to, or will be in a position to move the stage from stage level 5 to level 4.
The President will be addressing the nation and will give a lot of guidance on those issues. All we can say is that once all of the assessments have been done, it will mean that there will be different alert levels assigned to different parts of the country, and therefore different actions expected into different parts of the country. Whether it's a district, whether it's a metro, they will have to be based on that assessment. We will have to wait for the President's first to give guidance, and thereafter there will be the announcements that will give us the different stages if there should be any change. Obviously, as we look at it, there are very different stages at which different parts of the country are, because in one area there's a very rapid rise of the infection, as in this case in the Western Cape there's obviously a much higher level of infection there, and I think that's what the figures are showing. There are areas which have shown no increase, no new patients, no positive cases, and therefore we have to approach this issue very differently depending on what is the weight of the infection at that particular part.
Minister J.D. Paulson from the SABC. My question to you is that there's been concern that nurses are also afraid to fight this pandemic. Several people saying that, the nurses of the olden days will be, best equipped. There was the XDR as well that was more, dangerous than coronavirus. But now we're seeing a trend that they are shying away from actually treating COVID-19 patients. Is this because they are afraid of getting infected, not having the right PPEs, or is it also you spoke about a mental, challenge with regards to handling COVID-19 patients?
Actually, the COVID-19 is a new infection. It's really shocked the whole world with the numbers of people who have been affected, with the numbers of people who have succumbed, and the speed with which the infection has spread. It has really made everyone to feel uncomfortable. So there's nothing surprising when our nurses and our health workers, our communities, our leaders feel that they are nervous about it. It is really more because it's a new infection, and everyone is not certain how it's going to affect their own particular areas. And from that point of view, we do understand it. So our approach to it has been that we have to make sure we do a lot of training, we do a lot of explanations, But the bottom line is that actually the nurses, the doctors, get trained specifically on how to prevent the spread of infections, viral infections, bacterial infections, and any form of outbreaks. And therefore, it is when our training is stronger and the awareness is higher that we will be able to get everyone to understand that they need not be afraid of the COVID-19 infection, that the infection can be easily dealt with like any other infection. I think what is really our major concern is the getting enough information to the public to be able to change the behavior, because this infection the outbreak will be only defeated if the communities understand the issue of hand washing, sanitizers, cough and sneezing etiquette, and use of masks and distancing, because those are the things that are going to be our new way of life, so that we are able to prevent the further spread of the infection, especially when we don't have a vaccine or not adequate immunity. That is the way we're going to have to deal with it. And so it is more and more information, more and more training and improving awareness, and people understanding that each one of us can do something that will actually reduce the risk of us contracting the infection and also the risk of us spreading the infection to the next person. That is, I think, where our messages have to go. It needs to be understood that it's within our powers to be able to stop the infection. There is no need for us to fear it, but it's important for us to know that we can actually defeat it by just following the simple preventative and infection control rules. That is how we should be able to deal with this matter. Thank you. Thank you.
No, thank you very much. Thank you. Thank you, colleagues.
Sorry?